Hi, everyone. It's Amanda from Intimate Rose, and I am so thrilled to be joined by my dear colleague, another Amanda Fisher. She is incredible for so many reasons. She owns a clinic in Lee Summit, Missouri that specializes in pelvic health. And she is also the creator of some coursework to help empower moms to regain strength and awareness, and also to regain that drive and capabilities in the bedroom. So Amanda, thank you so much for joining me today.
Thank you for having me. A squared. I love
A
it.
squared. Yes. We hold so many things dear to us, including our names and our sense of humor, I think. And one of the things that is a strength in your clinical practice is you treat all the things. You treat all the people, you treat all the pelvises, but you have a tremendous heart for treating postpartum women.
Yes.
So tell me what that practice looks like. Tell me how you go about your initial evaluation and what treatment for a postpartum person might look like.
Yes. I will preface, we in 2020, before COVID actually happened, or we really went after our pregnancy population to try to reach these moms before childbirth so they could have a little bit more education and know that pelvic floor physical therapy was a thing. And we have seen really great results with doing that. When they come in, we typically ask all the questions like, how was childbirth? Did you have a vaginal birth? Did you have a cesarean? If it was vaginal, did you end up with an episiotomy or any tearing? And then how are things going postpartum? In a beautiful world, we would love to chat with these women like at 2 weeks postpartum, even if it was a virtual chat or a phone call where we're just checking in, how are things going? Just wanted to remind you of the things that we went over in the clinic. Don't stress over it. This is a time to really snuggle with baby, but to just be mindful that we're not like holding our breath, or if we're dealing with any pain, giving them different support ideas of how they can support their body or work on their posture while they're in those positions. We like to see them at 4 or 6 weeks postpartum in our clinic, whether it was a cesarean or a vaginal birth. And that doesn't mean that we're doing an internal exam on those weeks. We are truly working on more function. If the baby's 8 pounds, what does it look like if you hold an 8-pound kettlebell or a dumbbell and you're walking down the hallway after you change that baby's diaper at that weight? Like, what does that look like? And we want to see that in the clinic. Most often, moms will bring their babies in with them, so it gives us a good idea. And I'm sure anyone who's treated postpartum gals have seen this. Like, they will be beautiful, or anybody really beautiful in the clinic with posture. And then as soon as it's over, it goes back to the just shoulders way past the butt, totally arching their low back. And we're trying to really reinforce as much as we can in our clinic. Like, this is the stuff that you're doing all day. And instead of setting up maybe a program in the beginning, it's really looking at functionality of what doing with baby around the house all day, how you and how we can improve that for them to help improve symptoms, decrease pain, that sort of thing.
Absolutely. I love that you're seeing them as early as possible. And, we respect that tissue healing where we're not going to be doing internal exam until they're ready, but it gets them on their way with the breathing, as you mentioned. A lot of people don't realize that one, breathing is pertinent, and two, how much the rib cage changes, how the change in their abdominal length because of pregnancy can change how they're able to even sustain their core, and how that changes their breathing because of that piston nature between the diaphragm and the pelvic floor. So I love that you pointed that out, because a lot of patients are like, why are you watching me breathe? It's a very important part of our evaluation process.
I'm always like, this is the most important step. This is like the light switch to the rest of the stuff working well. And if you skipped level 1, like level 2, it's like you cheated your way there. It's never going to end well. So you really want to make sure like the light switch is on. You can see your surroundings. So now it's maybe connecting with the pelvic floor. When you're breathing in, the pelvic floor is lengthening. As you're blowing out, the pelvic floor is hopefully rebounding up a little bit into a little bit more of a contracted air state. And that it's moving like a trampoline, because it should move. Your pelvic floor
Yeah.
should move. It shouldn't stay nice and tight. It shouldn't be loosey goosey. And then once that's working well, you're advancing on to level 3. You're trying to connect, the lower abdomen again, and then connecting that with the low back and making everything work really well with the hips and glutes and all, the full body approach. But the breath is the biggest thing, because if we forget that, we can hold our breath when we're getting up out of the recliner with the baby, or lifting the heavy car seat or diaper bag, and that's just going to push things further south. It can either have loss of urine, or we can start developing things like pelvic organ prolapse, things that we want to hopefully support and prevent, as our big goal for us wanting to see them so early, seeing the decrease in tissue integrity and hoping to improve that for them, so we don't have to see as many people with urinary incontinence and pelvic organ prolapse down the road, or hopefully preventing that, when they hit, 7 years postpartum, or maybe it's postmenopausal of that stuff happening. People have already taken good care of those muscles again and rehabbed them, so we can see those numbers start to drop in the future.
Absolutely. And decreasing the amount of time where they're enduring symptoms that they don't have to be. It's, the
Yes.
stitch in time saves 9 kind of
Yes.
concept of you're teaching
Absolutely.
them from the ground up right away. So they may not even see those symptoms, or they're highly
That would be
lessened.
incredible.
Yes. That's wonderful. And what kinds of like resources and tools do you like to use clinically?
Postpartum, if they're dealing, so let's say after 6 weeks postpartum, they've been released from their doctor. If we're noticing tissue tightness, especially scar tissue around the scar vaginally, or maybe it's just in pelvic floor in general, we love the Intimate Rose wands and dilators, to use those for tissue mobility and for home exercises, I guess I would say. Then we don't have to see them in here as often. I tell our patients, it's kind of like foam rolling tissue, or getting tissue to move, or desensitizing the tissue that's been scarred over and sewn up. We really want to touch in on that tissue. We don't want to create pain and discomfort. We want to remind that tissue how to work. So they can use that for a couple minutes a day in the beginning. Maybe the wand is just sitting and touching the scar externally at that perineal area. Maybe it is just sitting inside and allowing that tissue to get comfortable with it. And then maybe they're starting to walk through exercises with it. But we really see great improvement. I mean, because you can have tightness in that tissue just with cesarean deliveries. I know I did. So I use the wand quite often. As moms, you don't feel like you get a lot of time to yourself. So it might be that you get the purple wand and it can sit in your shower. And maybe while you're showering, you can use that to touch the tissue. Or if you get a warm bath and you get time to do that. But whatever it is, it's like giving yourself a few minutes a day, because maybe 10 minutes sounds so overwhelming to them. So we start small, baby steps, see how much your tissue needs, because everybody's different. But that's one of the big ones we love postpartum. I'm trying to think of other resources. I know we have a lot. Sorry.
Don't worry.
Yoga blocks. We will sometimes use those as well for propping up, and maybe even for tailbone pain and discomfort, for rocking the pelvis and getting the tissue to move. I love things around the house. So I like to look, I think every mom is a female athlete. So if we're not using, like in the beginning, not using baby, because baby doesn't have great head support, our center of gravity is off and our balance is off. So maybe we're just using the diaper bag or the car seat for exercises. Yeah. Maybe it's laundry detergent or a gallon of milk. It's really using things like the step stool or your stairs, chairs in the dining room. Like, I really like to look at things, again, more functionality, but then also, like, they're carrying around that 8 to 10 pound baby or heavier a lot of hours in that day. And I want them to really recognize what tissue feels like in those positions and the posture that they are doing those things in. And maybe if baby is taking a nap, that gives them time to really work on like a farmer's made carry. So how are they carrying? Are they getting the lats to engage? Are they engaging the core? Are they bearing down? Like them getting a chance to really check in and recognize with this, just things around the house. If we do want heavier weights, a friend of ours, he's a PT, Nathan Carlson, really brought up the great idea of, this is back in the pandemic when the weights are gone, right?
Yeah.
Cinder blocks are $2 at Home Depot and Lowe's, and those are like 30 pounds. So if we eventually have a further postpartum mom, like we would have them go get a cinder block for $2 Home Depot or Lowe's to work with that. But then it can also be a step up too. So you were given kind of like weighted squats with it, but then also using it for other exercises too, which was pretty sweet. But that was probably the cheapest resource I've ever had somebody get.
That's pure brilliance. I've always
Wow.
been a very industrious person, and I like to make those kinds of recommendations to my patient too, especially postpartum. I mean, the bills are very, very high
Oh,
at that
yes.
time for one reason or another. So that,
Which
I
is
mean, I have
probably
never.
why like a PT never came up with the squatty potty, is because we've always been like, yeah, go get the phone books that we are not
Yes.
using anymore and tape them up. Had we taken the time to be like, oh, we should probably like build something genius so our patients could buy it, we would have come up with the squatty potty. But we're always like, oh, what's the cheapest? Can your husband build that for you? Or do you know somebody that could hammer this together? And now I'm like, shoot, yeah, get a squatty potty. Greatest thing ever, like for bowel movements and support to that pelvic floor too. So there's another good resource.
Yes.
But yeah, the cinder block, cheapest thing out there, and it is wonderful. But they
And
usually,
it could be a squatty potty. You could take it in the bathroom.
genius. You're right. You're right. It could be. It's just, yeah, we have to like work our way up to that 30-pound-ness. Cause yeah, definitely don't want things coming out when they're lifting that. But yeah, we like to, anything that we can get them in positions where they're kind of awakening the whole pelvic floor, is key for us so that it can help them during their day. I totally different before I had children on how I treated these patients. And then after having multiple kids, because we've got 3, a 7, 5, and a 3-year-old, it changed my complete outlook on how I was treating pregnant women and postpartum. So I would be like, okay, I'm not supposed to lift my kids, but I have 2 and one is 30 pounds. So I'm actually like, I am lifting that weight. And how am I doing it? Oh, it sucks really bad. So I need to work on form, but how can I build that up? And what can I use at home to do that? And then realize like, I'm not the only one who has 2 kids under the age of 2. Like there are other moms out there. And starting to play into that. Again, the money thing was huge because we went through that as well. And with me not working as often and starting a business, and you had to get smart with like weighing things around the house. Like, yeah, I think this is about the weight of the kid. Okay, let's use this. Yeah, get creative.
Absolutely. I'm in the same boat too. I became a pelvic health specialist prior to becoming a mother, and my sense of my just sense of what's possible totally changed. I mean, it's because it's a whole new world, and it opens up,
Right.
to the exhaustion. It's like we have deep empathy for that as healthcare providers,
Yeah.
but it's different to feel it and to
Yep.
experience it. And I think, I started my career in pelvic health as having pelvic pain prior to
Yeah.
getting pregnant and delivering my babies and wrecking my pelvic floor in a totally different way. And so that's just totally changed my vision as well. So I agree wholeheartedly.
Yes. It's a whole different ballgame. And then dealing with like, well, how long will it take for this to close back up? Or when will my abdominals get tight again? I'm like, I don't know. Like my 3rd kid, it took me 20 something months, like my 3rd C-section. So every journey is completely different and every delivery is completely different. The more you have, the more stretched out you've been. So it's not going to change over time. You've got this nervous system that you've got to rewire again. So I try to be real, I guess, because that they see so much different stuff on Instagram or social media in
Oh,
general, and
yeah.
trying to be more like, hey, it took me this long, but hopefully it takes you less time. But let's put, 2 years as a big picture. And if you beat it, hot dog. If not, then, that's okay too, because a lot of us are around that time frame. I was past it. And I'm fine with that. And I feel like I'm still working on it too, with being 3 years postpartum. Like you always have things like, oh, I probably pushed it a little too hard, but it's a constant trial and error thing to get back to do what you love to do.
Absolutely. And this, every person has different support and ability to dedicate to themselves and
Time.
different tissue
Yeah,
healing time. I
you
mean,
got
just
it.
genetically, we all have different we all have the same types of tissue in the same types of places, but our healing journey is totally different depending on other factors like you have autoimmune disease or if you've had other surgeries, other hormonal situations. It's all of that goes into key. And like you said, they see on Instagram, so and so is like back in her bikini. And that's can be really disheartening to some. And I love your attitude and your approach to it and setting like realistic expectations and focusing on the positives with the functional aspects. Look what you can do.
Yeah.
You can lift this 30-pound cinder block that you got for $2.
It's way more
Feels
important
really
than
good.
that flat belly.
Yes. Look what you can do. Look what you did.
I
Gave life
did.
and
I think I posted, it was probably over the summer. Like I had been really working on my core, and the picture's not pretty. It's the picture. To me, it's pretty because I was like, yes, I'm doing things that I finally have done again. But it's a saggy postpartum belly, mommy belly. And somebody did reach out and was like, thank you. This gives me a good idea of what I will look like. It's like, I'm so sorry. This is stretched out. This is a stretched out belly. And this is what like core can look like. It doesn't have to be 6-pack abs. Like this is still a strong body. And that was really the image I wanted to kind of put out there was, you are a strong mom. It doesn't have to be, washboard abs, but I'm glad that could help somebody feel a little
I
differently.
love it. I love that framing. That's awesome.
Thank you.
And recently, you put out an amazing resource of your own. You have your ebook on Amazon, but you just put forth a massive undertaking of a very comprehensive series of courses.
Yes.
One is Body After Baby, which essentially taps on what we talked about. So, what's involved with Body After Baby?
Yeah, our Body After Birth program, it's a 12-week program for postpartum moms. They can begin it really in that early, like 4 to 6 week range postpartum. If they did sooner, like it really hones in on the breathing. Like I want the foundation build up with that. That's the main focus of the first couple of weeks is like making sure you're getting the breathing, making sure you're doing some stretches to help out with spinal mobility or putting in a little bit of like shoulder stretching too, to what is tight basically with our postpartum moms. Like most of us are sitting in this rounded posture, snuggling our baby 23 hours a day. It feels
Yeah.
23 of the 24. And thinking through how we could create blood flow circulation and stretching out that tight tissue around the ribs as well to help that diaphragmatic breath go through. And then connecting the dots again with, diaphragm, pelvic floor, lower abs in the back. Each week it has like 5 main exercises and then builds up with a new exercise if the mom has time. If it's a busy mom, stick with the top 5. If they're ready to add something on, maybe they got some sleep and their baby is not having a growth spurt, then they can do so. There's like bonus rounds, bonus exercises to do. It's really encouraging the walking that they can do because that's great for pelvic floor, blood flow, and circulation. It goes over some baby wearing techniques as well, because baby wearing is very big for moms. I look at it as an endurance sport because we don't typically baby wear for like 5 minutes like we probably should in the beginning. It's like, oh, strap the baby on for an hour, get as much done as I can while the baby naps on my chest. It's going through those postural techniques with that and how to build it up. Lots of support. I absolutely love it. It's 12 weeks worth. Hoping to advance that on here sometime in the future as well to hit more of a little bit of our moms that want to get back into maybe more higher impact activities as well.
Absolutely. And that's available online. So that's available to everyone, everywhere. You can access it at any point, self-progress. And as you mentioned, there's extra if people need extra. And there's also the ability, which naturally happens, to take a little bit longer in between each stage, which is
so
what
lots
I really
of
loved.
lots of tips for those busy moms who are just like, I can't get stuff in. So when can I get it in during my day? So lots of those type of ideas too. Because I had colicky babies and we see a lot of moms with colicky babies too. And I really wanted to help those women out as well.
Absolutely. And then you also launched Empowered in the Bedroom.
Yes. We were so excited about that one. That one had been in the back of our mind back of my mind for quite some time. I, like you, had pelvic pain when I started PT school. So when I was like 21, 22, dealing with pain with intercourse and having to navigate through that, and then finding out it was, in my profession. And I always felt like this was a thing that we just weren't talking about with our women, and our caseload is heavy on pelvic pain as well. And then Bridgerton came out on Netflix, which just happened to help us kind of like rip off the Band-Aid and run with the program. So it's 4 weeks of, questions maybe that people have, like about orgasms and pleasure and what type of pleasure should I be feeling? What stretches are great for intercourse? If I'm dealing with prolapse, what's a good position for me to be in, or low back pain? We've got interviews on there with a couple sex therapists and female doctors that I absolutely loved just chatting with them, and they're like very knowledgeable on the pleasure as well. So different things that maybe we had started implementing with our patients, but then it takes it to a whole nother level, which is really fun to see. And then we talk about products on there, like certain vibrators with those docs, or if they are dealing with pain with sex, definitely the Intimate Rose line as well. And really going through how those can be used and how maybe they need to talk with their physical therapist as well before actually using them to figure out where exactly they're dealing with their tightness. Also talking on there about the drip stick, which is a fun little thing that has, it's like a sponge on a stick. So giving them different products, I guess, that, so the sponge on the stick, sorry, I quit that sentence. Inserts after your husband or spouse or partner goes inside of you, and it sucks up the liquid and comes out on the sponge. So then you don't have to leak it all day. So brilliant. But that was like, that's part of our products video as well. So just little things that we've kind of tested out, and it's kind of our loves, what we really recommend to our patients. And then our favorite lubes as well. Cause who doesn't love a good lube, and it's definitely needed. So yeah, it's a fun 4-week self-paced program, that we've gotten a lot of great feedback on. It's been awesome. Cause you don't realize like how many people actually out there were wanting it too, and have responded really well to it.
Absolutely. It's kind of one of those things where I think the focus gets put on what we just talked about with function and incontinence and being able to like do the task of taking care of the baby and all the activities of life. And then there's, oh yeah, there's actually fun things in life too, and intimacy, right? And that it should not only be just not painful, but also enjoyable. Yeah. And I've also really loved having conversations with sex therapists because they look at it so differently. Yes. And it's so beneficial because, one of the cool things that I learned from some of my interviews with the sex therapist is that different ways that pleasure doesn't have to be sex. And it's, it's not like the cute, sweet things like he brought you your coffee in bed. It's, looking at ways of instilling moments of pleasure and feeling good that doesn't necessarily have to be penetrative in nature. And I think, perhaps it was never learned, or it's been long forgotten because we reach certain phases, maybe in marriage or in relationships, and especially after baby, where it's like, we got 2 minutes, let's go. Gosh, yeah. It's no longer this like, really impassioned thing. And it's really important to go back to that. And that process helps the body prepare physiologically. It also helps our emotional state to be ready. Women need longer time. They need different types of sensory input to get to that place. We are not like a microwave.
Right. We always say that men are the microwaves and we are the crock pots. And it was really interesting to hear the other therapists say it as well, just in a little bit different way. That like, and then doing the research, like, it can take it can take 20 minutes just to get blood flow and circulation for arousal down there. And then another up to 60 minutes for actually orgasm. So to give people, I guess, just like the education to not feel guilty that it's not as quick as it used to be when they were younger, when we didn't have stress and children or life was different. That now postpartum, things have changed and it's okay to be in a different body. And maybe my partner, I'm concerned about how I look on the outside, and my partner could care less. They're not worried about that at all. But in my head, that is acting as a break. It's slowing down my arousal process. So figuring out what is the pleasure that can help me reach that arousal state to want us to connect. Maybe it is that I do need a warm bath before we go into the bedroom, because that's going to help me de-stress. It's going to really help with that tissue. I can lay down and listen to some meditation or work on my breathing to help that tissue move better. I can do some stretches prior to us connecting in the bedroom. But yeah, it not having to be intercourse. I wish someone would have said that to me years ago after each of my kiddos. And we started finally saying it to our moms, like, well, yeah, like you can't have, maybe you're nervous of having intercourse, or maybe before 6 weeks, could you arouse that tissue to get blood flow to help that tissue circulate and heal? Because that sounds like a brilliant idea. And let's see what it feels like. Does it feel hypersensitive with just bringing the arousal down there? Is it, at what place is that happening, and what can we work on to make sure that that's changing prior to you guys connecting with intercourse, and letting them know, like, I never want people to feel guilty. Like, I hate the question, but we need to know, they come in like, have you guys attempted intercourse yet? And their face, I would say 9 times out of 10, and it's always like, no, like they're always like, but we're going to get to it. It's just, wait. And like excuse after excuse. And I'm like, I'm not judging, nor did I at 6 weeks. Like, I want you guys to take it slow. We want to make sure this tissue is working well. That's just part of my routine questions of, have you guys attempted? What did it feel like? Was it uncomfortable? But definitely not pushing it at all, because we don't want to
Absolutely
stimulate any kind of painful response over and over and over.
Yeah, which does become cyclic. Absolutely.
Yeah.
That's great. I love it. What a tremendous resource. And that is also online and available.
It is. And it isn't just for postpartum women. It does. And our last week is where we really break it up into, if you are interested in postpartum intercourse, you can watch one video. If you're interested in, intercourse after menopause or during perimenopause, this might be a great video for you. So it gets more categorized in that 4th week of what they're dealing with, or maybe specialized questions that they may have too. So yeah, really for anyone. And everybody has a pelvic floor. And we know at some point in life, this took us talking to one of the other interview healthcare providers, that I think now the statistic is 1 in 2 women at some point in their life cycle will have pain with intercourse. And I was like, thank you for somebody doing that research, because I remember when I was going through it a decade ago, it was still 1 in 7. And I felt so like, 1 in 7, I'm 1 in 7. Like, that's a small percentage. And now knowing it's 1 in 2, it's like, gosh, everybody needs to know about, if you're dealing with these symptoms or when they arise, what can I do to improve it, instead of living with it for so long. And then now we're dealing with that, persistent pain cycle, and how we can recognize it and change it sooner would be a lot better in our opinion.
Absolutely. That's amazing.
Thank you.
Is there anything else that you would like folks to know?
Yeah, we've got a lot of our courses online. We have the pregnancy. We did talk about body after birth. We've got our Empowered in the Bedroom. We've got a bundle right now. The lucky bundle is our Empower Your Rear and Empower Your Core mixed together. So hitting the pelvic floor's best friend, the glutes, and connecting them as one, because who doesn't love spending time with their bestie? So we decided to bring those two together. Yeah. And then with all of our programs, you get put into our Pelvic Posse Facebook online community, which is great because you can ask questions there anytime. And then we'll hop in on Facebook Lives. And if nobody's asked a question, then we'll just pick a topic and run with it for that week. So it's a lot of fun. I love helping women. I love normalizing pelvic floor issues. Again, you've been there, like, what it feels like to not talk about it a decade ago, and it's all hush hush. And now we're actually like tapping out in the market and social media, and people are asking questions and sometimes sharing way too much information. But I love that. I will take that any day over what it was doing a decade ago, where we were still like tiptoeing around the subjects. So it's so fun.
Absolutely. Those untold stories were helping nobody and like breaking through. I think a threshold has been broken, and now people are sharing more and more, and people are feeling less alone. I think that we have got nowhere to go but up.
Right. And like, we're making reels on Instagram now about pelvic floor issues. I mean, how cool is that? That's incredible. You can just put it out there and people are like, yeah, get it, girl. Yeah. Absolutely.
And yours are definitely the best. If you have not checked out Amanda's reels on Instagram, she is, I mean, it's art. It is pure art.
It's my way of releasing stress, I guess. Like, I always felt like this is totally off topic, but when you're in PT school and they're like, this is like for creative people, because you get to create exercise plan for people. And I was like, I have never felt creative. And now these come out and I'm like, oh, hey, this song on the radio could totally be a pelvic floor song. Let's do it. And yeah, that's an everyday thing now. It's really a ton of fun.
It's so nice when you find that thing and you feel like, yes. And for me, it's like choosing the colors and the design patterns and things, and it's tapped into something creative. I mean, I've always liked creative things. I was a color kid, I love the color. So yeah, we all have our thing. So I think it's phenomenal. Yours is just way funnier than mine.
I like yours a lot better. You have a better talent.
Oh my goodness. No. Oh, well, so people can find you on Instagram at Empower Your Pelvis.
Yes, empower.your.pelvis. Our website is empoweryourpelvis.com. It all connects into our Facebook, which is still Dr. Amanda Fisher, DPT on Facebook. Trying to tap into the TikTok world. It's not working as smoothly as Instagram. It's a little different.
We're in the same boat.
Yeah. I'm just trying to like copy the video that does well on Instagram and paste it on TikTok, and it's nothing. So I'm like, okay, different population.
You're not alone, and it is a different population. So we'll figure out how to communicate with the different platforms.
I don't know the dances for TikTok, nor am I a dancer. So I don't know how to tap into that one yet. Still working on it.
Absolutely. All right. Well, we'll have everything linked up here. And thank you so much for meeting with me today. And thank you so much for all of the great work that you're doing in pelvic health. It's reaching a lot of people that are, I think, really aligning with your amazing sense of humor. So thank you.
Amanda, I appreciate it.